And welcome to everybody, both locally and across the country, I think even across the world. We're very happy to be able to talk with you today about these exciting educational programs that we've developed here at the University of Colorado Skaggs School of Pharmacy and Pharmaceutical Sciences. And this is really an opportunity for you. I'll give you a brief presentation of what our programs are about, who they are tailored to, and really answer any questions that you have. We'll open it up at the end for Q&A, but if you want to type questions along the way in the chat box for Justin, that would be outstanding. So thank you again. As Justin mentioned, my name is David Kroll. I'm a professor of natural products pharmacology here at the CU School of Pharmacy on the Anschutz Medical Campus. I also used to have a research laboratory studying plants as sources for anti-cancer drugs and antibacterial drugs, and teach already a herbal pharmacology course here at the School of Pharmacy. I had been away from the school. I was here in the 90s, moved to North Carolina, where I had an opportunity to work at Research Triangle Institute, which is a nonprofit institute in Research Triangle Park that just serendipitously administers research grade cannabis to laboratories across the country that are funded by the National Institutes of Health. So I've always had, in addition to my anti-cancer work, a strong interest in cannabis and other drugs that are used by folks throughout culture that come from natural sources. So it's been very satisfying for me to come back to campus. I came back in 2019 when we started our master's in pharmaceutical sciences, of which cannabis science and medicine is a specialty track. So why don't I just go ahead and get started? And as I said, just please feel free to insert questions in the chat. For those of you not in the area, this is let me go ahead and share screen. Sorry about that, Justin. We've been using Zoom for how long now? And I'm still, no, this is great. So let's go ahead and share screen. All righty. So this is a picture of our School of Pharmacy building, the Skaggs School of Pharmacy on the Anschutz Medical Campus. For those of you who don't know, the Health Sciences Center in Denver used to be just east of downtown. And around the turn of the millennium, the decommissioned Army base called Fitzsimmons Army Base became the site of the expansion of the medical center, Health Sciences Center, now becoming the Anschutz Medical Campus. And pretty much everything on the campus, other than some of the original buildings, are really no more than 15 or 20 years old. And this is the Skaggs School of Pharmacy is a beautiful building to work in and to teach from. We are, let me go ahead and do this. Of course, this is an online program, but we always welcome you if you're in the area or traveling through Denver to come and meet with us at the building. Just wanted to let you know, I work with an outstanding team of professionals. I'm very, very fortunate. Teaching is hard enough, but Justin Rowe and Rachel Wagmeister do an absolutely outstanding job from really start to finish in these programs. Justin Rowe, who you've already met, is our senior recruiting strategist. I would say that Justin probably knows our programs as well as any of our faculty members, probably better than some of our faculty members. Rachel Wagmeister, who you will interact with later on in the presentation, is our program coordinator. She's in our distance degrees and programs office, and she also administers our continuing education programs. So really two outstanding professionals. If I'm not available, these folks can answer questions, sometimes even better than I can. So as many of you know, if you already have an interest in cannabis science and medicine, you know that the medicinal plant, Cannabis sativa or Cannabis indica, has been part of medicine for literally thousands of years. And in conventional medicine, it was actually adopted by British physicians who were in India at the time before we had tetanus vaccines, and it was discovered that folks in India who were suffering from tetanus often got relief from their muscle spasms by using cannabis, either as a tincture or as a smoked material. And it really was 1964 when Israeli scientist Raphael Mechoulam and his colleagues isolated the primary active constituent of cannabis, which is called THC. What a lot of people don't know is that the very popular drug today, cannabidiol, the non-psychoactive, actually the non-intoxicating cannabinoid, was actually discovered almost 25 years earlier by scientists at the University of Minnesota. This is a picture I like to show because it demonstrates how cannabis has been part of pharmacy as far back as you can remember, and oftentimes spoken of in the same realm as the opioids, which have become just incredibly important drugs for the treatment of pain, particularly post-surgical pain and cancer pain. This is a picture. I had an opportunity to visit a pharmacy in Matanzas, Cuba. It's a city just east of Havana. And this is an old pharmacy that was started by a French pharmacist and an islander in Cuba. And here you can see extracts of different kinds of opioids. Here's laudanum. Here's an opioid extract called Adornidare, which is a French extract of opioids. And right here, right in the middle of it, is an extract, a fluid extract of cannabis indica. So you can see that, and then this pharmacy closed in about 1963. So as late as then, cannabis was part of conventional medicine all around the world, not just in the United States. Another example, this is from the National Formulary. This is from 1906. This is an actual formula used by pharmacists to make medicines that contained extract of cannabis. In this particular one, it also had a little, this print's very small, but you can see that it had a little bit of morphine sulfate, as well as capsaicin, tincture of capsicum. So it's pretty logical that a school of pharmacy like ours would be involved in the education around plant-derived drugs. We've been in service to the state of Colorado and to the country for 110 years. And we exist in a state which was the first by a few months over the state of Washington with adult retail cannabis being legalized. Colorado was one of the states that adopted medical cannabis in 2000. California was the first in 1996. But we've had adult retail cannabis since 2014. And what that has done, because so many people use cannabis as a medicine, so many consumers, so many patients, moving to a retail kind of marketplace led to people using cannabis for medical indications without any medical input at all. At least in the first 14 years, healthcare professionals had to give a medical marijuana card for a specific medical condition. So at least there was some consultation between healthcare professionals and the patient using a cannabis product for medical purposes. But now that you can, I live in lower downtown Denver. I've got a dispensary across the corner from me. People can go and purchase cannabis for whatever purpose they desire without any input from a healthcare professional. As I mentioned, plant medicines have been part of pharmacy for many years. In addition to myself, we have several faculty on campus who've been studying various aspects of plant medicines from the basic science side in our research laboratories. But what I think many folks, even on campus, don't realize is we have a really outstanding group of clinical cannabis researchers. Dr. Jackie Bainbridge, who has a joint appointment in neurology, actually got one of the first Colorado Department of Public Health and Education grants from marijuana taxes to embark on clinical trials with cannabis products provided by the National Institute on Drug Abuse through their drug supply contract, and is currently doing a study of cannabis and of cannabidiol in patients with Parkinson's. She's collaborating with people doing a study on using NIDA whole cannabis flower to try and reduce opioid dosages in patients with chronic back pain. There's several other similar studies going on our campus where our faculty are involved in the clinical use of cannabis. One thing I think that my colleagues here are exceptionally good at is that we've designed a series of online programs that are designed for busy professionals. I know some of you on campus are researchers, clinicians all around the country. You may be a clinical pharmacist, you may be a basic scientist. We design these programs so that you're able to take them at a distance and gain the education you want, and perhaps even change kind of your career trajectory. Specifically, we also have a dedicated online program office, online studies program office, and personnel like Rachel Wagmeister, who you'll meet a little later on. And our faculty have been leaders in online education for probably over almost 30 years, I would say, with the launching of our online US and international Doctor of Pharmacy programs. So today I'm going to talk to you about two of our three programs that have been launched to provide cannabis science and medicine education to healthcare professionals and to basic scientists over the last year or two, year and a half or so. We have, I won't speak more on this other than to say that we have a continuing education program that's been in place for 3 cycles now. It's a short 8-week program with 24 contact hours that gives 20 continuing education hours. That's, like I said, been through 3 cycles. It's not a credit-bearing program. It is a program for people to get continuing education hours for their certification in medicine, pharmacy, and nursing. And that program essentially formed the basis of our 2 subsequent programs that we'll be focusing on today. First, the Graduate Certificate in Cannabis Science and Medicine, which is a minimum 9 credit hour academic certificate for which you get a transcript and you get a certificate. And then a master's in pharmaceutical sciences that specializes in cannabis science and medicine. That's 30 credits, typical master's programs, about 30 to 36 credits, of which 15 credits solely address cannabis as a botanical medicine. And then there's an additional 3 credit final project in pharmaceutical sciences where you can focus on a project in your community on any aspect of cannabis science and medicine. The graduate certificate is what we'll talk about first. And probably the most important point for those of you viewing this for the first time is that this 9 to 11 credit certificate allows you to transfer all of your credits once you're done to the master's in pharmaceutical sciences below, if you should so decide after that first year or 2 that you would like to expand your studies further. So let's break these things down. First is the Cannabis Science and Medicine Graduate Certificate. It's not a full degree, but it is a certificate that's becoming popular all around the country, programs between 9 and 15 credit hours in various specialty areas. We have them on our campus, other programs in the School of Pharmacy, the School of Public Health, and the School of Nursing. Just by way of introduction, the CSM Graduate Certificate comprises 9 credits of core coursework that can be completed in a minimum of 2 semesters, although for the busy professional, we allow our students to take as long as 2 years or 4 semesters to complete the coursework. I'll show you a map of the curriculum in just a moment, but this is how the courses are laid out. The first course is a 3 credit course on the pharmacology and physiology of cannabinoids by exploring the endocannabinoid system that exists in our own body that was first discovered in 1992, that we actually make lipid chemicals from our cell membranes that bind to our own cannabinoid receptors, just like THC, but in a very short duration of action. Their action is predominantly to modulate other neurotransmitters, but we have these receptors all throughout our body, both in the periphery and in the central nervous system. In the periphery on immune cells. So the diverse actions of cannabinoids on a variety of organ systems has its basis in the fact that we have these naturally occurring physiological systems in our bodies. This course is directed by yours truly, and I have a series of guest lecturers from around the area and around the country who talk about these issues. Then we have 2 pharmacotherapeutics classes that address cannabis as a medicine in specific therapeutic areas. The first course, Cannabis Therapeutics, with an emphasis on neurology and mental health. It's a 2-credit course taught by Dr. Jackie Bainbridge, who I mentioned earlier, was our first clinical cannabis researcher on campus. And then in the spring semester, a second therapeutics class, which is co-directed by Dr. Laura Borgelt in the School of Pharmacy and Family Medicine, and Dr. Ashley Glode in the School of Pharmacy and in Medical Oncology, who discusses cannabis products in pain, supportive oncology care, and some of the concerns that we have in at-risk patient populations, such as pediatrics, adolescents in particular, and geriatric patients in pregnancy and lactation, and then a really terrific 2-credit hour class. And then the certificate closes with a 2-credit class in legal and regulatory issues in cannabis science and medicine. As you know, states vary in how they regulate cannabis products as medicines or for adult retail use. And the federal legislation that continues to rear its head is also discussed in this class. This is led by Dr. Gina Moore, who has a PharmD and an MBA. She's a past president of the Colorado Pharmacists Society and is our legislative liaison to the school. Sorry. Go back to the presentation, my apologies. So Dr. Gina Moore has a lot of expertise in legal and regulatory issues in pharmacy practice, and she applies this specifically to cannabis science and medicine in this 2-credit hour class. So that's the core curriculum. That's 9 credit hours, 2 courses each semester for 2 semesters. And then we provide an option for those of you who are either healthcare practitioners interested in how the industry actually makes cannabis products and does quality assurance and tests for impurities, potency, mold contamination, and so forth. We have an optional laboratory methods class that consists of a 2-credit hour lecture class, and that's online also, which would add up to 11 credits in the graduate certificate. And for those of you in the area, there's an option of taking a 1-credit laboratory methods workshop that runs together with this course, which would give you a 12-credit certificate. But the core is the minimum that you would have to take to obtain this graduate certificate. So how does this look in the calendar year? Here is a depiction of a typical program curriculum for the fall and for the spring. In the fall, the cannabis pharmacology and endocannabinoid physiology class runs the full semester. It's front loaded so that you get a lot of the information in the first 8 weeks. And then beginning in week 9, the first cannabis therapeutics class starts. It's 2 credits that's compressed into the second half of the semester. Again, online with recorded lectures, as well as discussion boards and some student projects. So that fall semester, you have 5 credits total. Then in the spring semester, you have the opportunity to take the second therapeutics class that emphasizes pain, oncology, supportive care in at-risk populations. That's done in the first 8 weeks of spring. And then in the second 8 weeks of spring, which is going on now, the legal and regulatory issues in cannabis medicine is taught by Dr. Moore. The optional additional coursework, the chemical analysis laboratory class and laboratory workshop itself, are offered in the second year of the program, and we're currently working on administering that for spring of 2022. And I can speak more to that later for any students who are interested. So that in a nutshell is the Cannabis Science and Medicine 9-credit graduate certificate that can run up to 11 or 12 credits, depending upon your level of interest. This Cannabis Science and Medicine certificate also can feed into a master's in pharmaceutical sciences, which we began here on campus in 2019, which takes advantage of our long-running PhD programs. We've had a PhD in pharmaceutical sciences for almost 70 years and a PhD in molecular toxicology for the last 30 plus years. The master's in pharmaceutical sciences gives students a core of coursework that expand beyond plant medicines, take into account all manner of how drugs are discovered, developed, and get to market. Students have an opportunity there to specialize in any one of these 4 research areas, but we recently added the Cannabis Science and Medicine curriculum, taking the courses from the graduate certificate, adding a few other courses, as you'll see in a moment, and then mixing it together with our core curriculum in pharmaceutical sciences. We took this approach primarily because we thought that people who wanted to become researchers in cannabis science and medicine would need more than just cannabis-specific coursework. And because we require some fundamental courses for all of our other specialty areas, adding cannabis science and medicine specific coursework was a relatively straightforward task. And what I think this does, compared to other programs that might be specifically focused only on cannabis science and medicine, is it really gives you 2 ways to market yourself predominantly in the research community, but also in the healthcare community. And that is, you have specific training in the research and therapeutics of cannabis, but you also end up with a master's in pharmaceutical sciences that gives you flexibility depending upon what the job market looks like in our post-COVID economic recovery. A master's in pharmaceutical sciences allows you to work as a research laboratory technician. You can run laboratories for PhD or PharmD professors or MD professors. And then the training on a specific plant medicine also allows you an opportunity to have skills that could be applicable in the dietary supplement industry, particularly with regard to botanical medicines. So this is a little bit more involved, and we've color-coded this so that it doesn't seem so overwhelming. This is the first year of a typical curriculum for the Master of Science in Pharmaceutical Sciences and the Cannabis Science and Medicine track. And in blue are the core classes that are taken by all of our master's students. In fact, all of our PhD students. There is a Fundamentals of Pharmaceutical Sciences class, you'll note, that runs 3 credits a semester across the entire first year, where students get exposure to all the professors in the department and their research programs, providing information on everything from drug discovery, protein-based therapeutics, and genetic or genomic technologies in drug development. Then all of our students take a 1-credit Ethical Issues in Toxicology and Pharmaceutical Sciences class, and an applied statistics class taught by Dr. Laura Saba, a biostatistician who works on large data projects in a variety of areas, including alcohol abuse. I wish I had Dr. Saba for my statistics class when I was a graduate student, because I know I would understand it a lot better. She's an outstanding researcher, but a particularly gifted instructor. And then here in red, you'll start to see the cannabis-specific classes, many of which were already addressed in the graduate certificate program. So the first semester, you would take these core classes, and you would take these the cannabis pharmacology and endocannabinoid physiology class led by myself. Just like the graduate certificate program, which is a 1-year program that allows you to finish in 2 years, the Master of Science program has even more flexibility because it's administered by the graduate school, and we have traditionally had students taking these master's programs part-time. The graduate school allows you to finish the 2-year master's program in as long as 7 years. So that's an important thing for those of you who are concerned about how much time could I devote to getting a graduate certificate, or how much time could I devote to getting a master's degree. In the springtime, you'll see that you have that second semester of the fundamentals class. The second, in this case, the first cannabis therapeutics class, it starts with the pain, oncology, supportive care, and at-risk populations. And then in the master's program, these 2 optional chemical analysis classes, the class and the laboratory, are now required for cannabis science and medicine specialty students in the master's program. And then in addition, we try to also make sure that our students are well qualified for oral and written communications. And we have a scientific writing class where we'll focus specifically on cannabis science and medicine, from regulatory documents to what's allowed in the retail setting, to how scientific manuscripts and scientific reports are drafted and disseminated. Now, in the second year, you'll see that we have a lot more courses that are in green. These green courses are elective courses. You have a space up to 3 credit hours to take elective courses, but you're entirely open or entirely eligible to take any variety of elective courses. In the fall of your second year, we have only 3 credits of required classes. We have the cannabis therapeutics with neurology and mental health, and we have a 2-semester course, which is a seminar or journal club in cannabis science and medicine. 1 semester focuses primarily on basic science literature, and the second semester focuses primarily on clinical applications and clinical trials with cannabis-related products, including cannabis medicines that have been approved by the FDA. Probably the biggest, most important and most fun part of the program is the 3-credit capstone project that you do during your last semester, together with taking just 2 of the 2 minor courses, the legal and regulatory issues and the seminar or journal club in cannabis science and medicine. The capstone project is where you have an opportunity to develop a product, a report, a guidebook for fellow healthcare professionals, pretty much any aspect of your interest in cannabis science and medicine can qualify for a mentored project that's written up at the end of the semester as a final requirement for the full master's degree. We gave you a large list of electives here simply because people are coming to these programs with so many different types of interest. For those people who are interested in some of the risks of cannabis products, particularly risks of other contaminants in cannabis products, we have a molecular and target organ toxicology class and an environmental and target organ toxicology class that addresses some of the health risks with some of the pesticides that might be used in cannabis cultivation, heavy metals that might be taken up from the soil, from grow facilities that are not indoors, and any other variety of mold, mycotoxins, toxins that come from mold that might contaminate cannabis. If you're interested in the pharmaceutical side of cannabis-related drug development, we have a class on the development of drugs and biologics. We have a class in pharmacogenomics. For those of you who want to get more into clinical trials, we have with the biostatistics program, a design and conduct of clinical research. Many of these courses are taught online. Some are only taught in person, but depending upon your particular situation, we can find you an elective or 2 that meet your particular levels of interest. So who are these programs for? The eligibility for the graduate certificate is that we really just are looking for folks who have a bachelor's level or equivalent or higher in a biological, chemical, medical sciences, or allied health profession. Or we've taken into the program students who are currently in good standing in an accredited health sciences professional school, whether it's medicine, osteopathy, physician assistant, doctor of pharmacy, dentistry, and the various levels of nursing practice. All that's really required there is that you've completed, when you enter our program, that you've completed 1 year of your professional program and are in good academic standing with GPA of 2.0 or greater, or whatever the GPA requirement is in your school for good academic standing. And if you are an intern, such as our students in the Doctor of Pharmacy program who are licensed by our State Board of Pharmacy to be pharmacy interns, you have to be in good standing with the internship. And I'm going to have Rachel Wagmeister come on in a second and discuss the application procedure and the admissions procedure for the graduate certificate. But I'd like to just finish up with the similar thread for the master's program. For the master's program in Pharm Sci, again, it's just a minimal requirement of a BS or BA or equivalent in a biological, chemical, or medical science or a health profession. Cumulative GPA for our graduate school has to be 3.0 or higher. And while we've had people come in with a bachelor's in biology who've maybe done field research or so forth, I really strongly encourage that you at one point have coursework in both biochemistry and either human physiology or human pathophysiology. A lot of our incoming students we've accepted tend to take these courses as minimally as a Coursera course. There's a superb human physiology course on Coursera that's taught out of Duke University, where I used to be on faculty and did a sabbatical. And then there are a host of biochemistry courses you can take at community colleges, at your state universities or private universities in your area. And here we have the link, and I'm sure that Justin will be providing this in any follow-up materials. The admissions requirements for the master's, this is taken directly from our website. It's a slightly different application. So you would go to this, the master's page to do a completed graduate school application. I already mentioned the BS degree. We ask for a written statement of interest or experience about why you want to pursue this degree in the specific specialty area. And then we ask for at least two references. We ask for at least two references from persons familiar with your academic performance, potential, character, and suitability for graduate study. It's an electronic template that's sent out through the graduate school. You simply fill in the names and email addresses of your potential referees. We no longer require the graduate record exam for the graduate school. The only exams we do require is that if students are coming from institutions where English is not their first language, or that English was not the primary language of study for the degree, you're required to demonstrate proficiency in English as a foreign language by either the submitting the TOEFL results or IELTS, which is used often in other countries. So with that, I see that we've got a fair number of questions coming up in the chat.